Mr. Chairman. Thank you very much, Mr. Chairman and Ranking Member Reed. And I want to thank my colleague, my classmate, Senator Reed, for an extraordinarily good statement with respect to the exemplary role the National Guard is playing right now. And I thank both of you, Chairman Hoff and Senator Reed, for the chance to come. It's a privilege to be able to introduce a longtime friend, General Dan Hawkinson, and I understand that his wife Kelly is there, and I think perhaps even his 4 kids. They are all military all the time, and Oregonians are just thrilled that he has been nominated to serve as the next chief of the National Guard Bureau. And I will tell you, you all have got the right guy for the job. As both of you, the chairman and Senator Reed, have touched on, we need sensible leaders with sound character and strong morals now more than ever. And if you look at General Hawkinson, what you will see is somebody who embodies those values. He's a West Pointer with a long and distinguished career. He's led our troops in Iraq. He's led them in peaceful missions at home in Oregon, and he has served at some of the highest levels of National Guard leadership. At home in Oregon, I can tell my colleagues on the committee, we really don't have the big military bases that you see so often, for example, say in the East and the South. So we've got so many Oregonians expressing their patriotism through the National Guard, and many of them serve 2, 3, 4 tours of duty, and we are so proud of them. And General Hawkinson, I can tell you, has been a source of inspiration for many of those Oregonians who've served in the Guard. Now, I'm going to wrap up with just one kind of simple statement. If I were to go through Chairman Inhofe and Senator Reed, the list of awards and decorations that General Hawkinson has earned, I'd still be talking at breakfast time tomorrow. So I don't want to be accused of filibustering you all, and we want to get this good man confirmed. And I'll just close by way of saying, I believe he will be a superb chief of the National Guard Bureau. Thank you for giving me the opportunity to come. And I certainly hope that the committee will report this outstanding public servant favorably, and the Senate will confirm him in short order. Thank you.
preparedness. HHS works with many countries to improve health security capacities pursuant to GHSA commitments. This includes helping complete a joint external evaluation to assess preparedness, developing national action plans, and mobilizing resources. As GHSA core capacities are based on the international health regulations, both efforts I've discussed, leading GHSA 2024 and forging ahead on WHO reforms focused on strengthening the IHRs, are mutually reinforcing and will help bring about a safer world. Thank you, Mr. Chairman. We look forward to working with the Committee on Global Health Security.
Well, thanks to all of you. It certainly looks like we've got the right panel here to give us the information we need to try to go forward. Mr. Richardson, let me say, first of all, thank you for reminding us of how critical and pivotal the role of the United States is in any kind of a global challenge. And most importantly, how generous Americans are. The 330 million of us compared to the 8 billion in the world contribute an incredibly high percentage of the aid that is given to less fortunate people. You made one statement that I'd like to focus on a little bit, and I'm going to follow up on this with Mr. Grigsby also. But you said you fear that future pandemics are going to look a lot more like this COVID-19 than the ones that we've experienced in the past. Your thought, could you drill down on that a little bit? Why you say that, and what do you mean by that?
Yeah, I appreciate the question, Senator. I think when we start looking at what is the real differences between this pandemic and whether it's Ebola or SARS, both of those were fairly localized in scope. The challenges that they presented were probably overwhelmingly focused on the developing world. And this pandemic, and I think given the globalization realities that we find, the fact that we can easily travel around the world and that's continuing to accelerate, I fear that mobility will drive epidemics, the outbreaks somewhere to then be able to be spread more easily through the developed world, in addition to the developing world. And
let me stop you there. Is that as I look at these things on the differences in the virus, take just Ebola, compare it to COVID. The transmission mechanism is very different on the two. It seems to be, and the contagiousness of the disease seems to be very different. And with 2,000 viruses kicking around out there, they're probably all going to have idiosyncrasies that are different than others. Is that what you're making reference to?
Yeah, no, absolutely. I think when you really look at what the challenge that we are presented with, the likelihood of transmission, the globalization of this world, and the ability for viruses to quickly move outside of a containment area, that's a game changer. And again, given the fact that it's been able to impact the high-income countries like the way it has, I think really makes us want to rethink how we approach this.
Yeah, that's what we're trying to do right here, and that's exactly the focus of what we're doing. And I think I think your identification there is important. In a minute, I'm going to ask Mr. Grigsby a little bit more about that because of the system we need to put in place. It seems to me that COVID-19, because of the way it transmitted and the rapidity at which it transmitted, is so different than those other things that we've had in the past. And in the defense of the systems that were trying to respond to this, they weren't ready for that. They didn't expect it. They expected that it would behave like SARS or like Ebola or something like that. And what we found out is that it behaved very differently and required a very different response, and that didn't happen. Is that a correct characterization?
No, absolutely. I think when you look at, we're not really sure what the next outbreak or next virus will look like or what it will do. I think I'll leave it to the scientists to talk about how it's transmitted or how much more it can move easily. But I think our systems are not built for this type of outbreak leading to this type of clearly it didn't work, right? So we need to. It did not stop the ability for this to become a global pandemic. So we really need to think about what kind of flexible mechanisms, both in the international system and in the U.S. government, that we can put into place now that allows us to be able to respond both at an outbreak and at a pandemic level, that is able to say, regardless of what the virus is, or regardless of where the outbreak starts and where it goes, we need to have an ability to respond. And this idea of a worldwide ability to respond is incredibly critical.
Well, and that's what Senator Murphy and I and this committee are focused on as far as trying to develop this system here. And thank you for being part of that. Mr. Grigsby, in my conversations with Mr. Tedros and his team, they were defensive in one respect I think was legitimate, and that is they said they didn't have enough power. And regardless of our criticism of them, we do have to realize that they're not a sovereign entity, and they can't really tell a sovereign entity what to do. They can certainly encourage them and try to press them to do the right thing. But it struck me that along with this conversation I was just having with Mr. Richardson, that they, as much as the rest of the world, were taken aback by how COVID-19 reacted compared to their dealings with polio or AIDS or Ebola or something like that. Is that a fair assessment of where they were as far as being taken aback by what happened?
Thank you, Mr. Chairman. It's fair to say, as Jim was alluding to, COVID-19 was a novel virus. It's one that had not been seen in human beings before. There's still a lot that we're learning about it. And by the way, we'd be happy to come up and brief you or your staff, not myself, but we have the leading scientists in the world at HHS, and they could answer some of these questions very specifically for you. They are still learning about this. I think that's a fair comment. And it is true, and that is a challenge, that the World Health Organization does not have a police force. It does not have a standing army to go in and enforce the international health obligations, which is only one of two treaties that are in the WHO that countries have signed up to and are obliged to comply with. But I think what we all know is that rather than even calling China out, what was really going on is that the leadership of WHO was praising China. This has happened before. We've been in this movie before. If you go back to the SARS situation in the early 2000s, the leadership of the WHO was a little more bolder when it was confronting China, and it did call China out. There were significant problems that happened that led, as I mentioned in my statement, to a revision of the international health regulations in 2005. But there's only so much that it can do, but it didn't even do the minimum it could have done, as in calling out what was really going on, the information that it needed, that it was not receiving. That didn't happen at all, unfortunately.
Thank you. I'm going to end here and turn it over to Senator Menendez. Before I do, what I want you to think about is we've focused quite a bit on what didn't happen and why it didn't. And what I would like to hear when I come back to you is I want your thoughts as what a system would look like if we were designing it now, which we are, hopefully, for the next pandemic that has the transmission is rapid and easily as COVID-19, because as we've now, I think, all agreed, this is entirely different than what we've dealt with in the past. We need a system entirely different than what we've had in the past, and we want your thoughts on that as to how we would go forward. Senator Menendez.
Thank you, Mr. Chairman. Mr. Chairman, just a comment. I agree that we need to continue working on a bipartisan approach. Before the last business meeting, we were working well on a bipartisan manager's package, and I, along with all the other Democrats on the committee, introduced the COVID-19 International Response and Recovery Act, and I hope we can find a common ground and a productive path forward, and I look forward to that opportunity. Mr. Grisby, I want to pick off on your last set of comments here, as well as your testimony, that China did not share sufficient information about the virus, and you just said that the WHO's words of praise for China actually exacerbated the pandemic because it did not pressure China to be more transparent. But President Trump himself praised China's response multiple times in speeches, public statements, and tweets. Quite explicitly, in one tweet on January 24th, he wrote, "China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well. In particular, on behalf of the American people, I want to thank President Xi," close quote. On February 6th, at the WHO Executive Board meeting, Ambassador Bremberg, who represented the United States, was similarly effusive, saying, quote, "We deeply appreciate all that China is doing on behalf of its own people and the world, and we look forward to continuing to work together as we move ahead in response to the coronavirus," close quotes. Those are just some of the quotes. So was the WHO's praise for China the fatal flaw, which necessitated the U.S. withdrawal from the WHO? And if so, why did the United States make similar statements of praise and support for China at the same time if this was detrimental to the global pandemic response?
Thank you, Senator. The comments you made are absolutely correct. Early on, the information we were receiving was that China was being cooperative. We were getting those reports from the World Health Organization. I remember having conversations early on at my level and members of WHO telling me how unbelievably transparent China was being, particularly compared to the SARS problem in the early 2000s. What happened was we received more information later, as we all have had, and information is going to continue to come out. And as that information changed, the tone changed, and that's just a fair comment. Last month, the World Health Assembly approved a resolution co-sponsored by, in fact, because it was a virtual assembly and much condensed as opposed to the normal meetings. They weren't able to do a lot of business. They had one item, and that was a resolution co-sponsored by 140 countries expressing concern, but also demanding that there be an independent review of what happened, including about the origins of the disease and its path to transmission to humans. So a lot of countries were saying good things about China's response early on, but then as more information came out, and it will continue to come out with these independent reviews.
I look forward to the review, and I certainly believe it's important. But the President's praise continued even after the ones I mentioned. Let me ask you this. You listed several reforms the administration would like to see at the WHO, including pressure for better compliance with international health regulation obligations and improving the process for declaring public health emergencies of international concern. That would be good for the world. But the Director General is not the person who decides on those reforms. It's the WHO, which is a member organization. Member countries make those decisions. How does the United States expect to influence other members to achieve reforms of the WHO if it has relinquished its seat at the table?
Senator, that's a good question, and I appreciate it. The fact of the matter is, the United States is a member of the World Health Organization now. The President has announced that that relationship is being terminated, and
well, if I said I'm terminating my relationship with you, why should I listen to you? Can you explain that to me? If you tell me you're terminating your relationship with me, why should I listen to you about anything you want to do with the organization that I no longer am going to have a relationship with?
Well, why don't I tell you what we're actually doing?
No, why don't you answer my question?
I'm doing that, sir. As you know, the United States has the presidency of the G7. this year that provides us an opportunity to speak with health ministries. In fact, Secretary Azar has, since early on in the pandemic, had once-a-week telephone conversations with all health ministers of the G7. As the situation with COVID-19 became more apparent, there was a focus on reform of the WHO. Those conversations continue, and some of the countries have asked us the same question. It's in the interest of the United States, whether or not we're a member of the WHO, to have a WHO that performs better.
Well, I appreciate your lengthy answer, which is a non-answer as far as I'm concerned. The reality is you have not made it clear to me how you're going to affect change at the WHO when you've terminated your relationship. Let me ask you one other question. If we create a new global trust fund at the World Bank, as I understand it from reading Senator Risch's bill, that's what it would do, would we just be going it alone? The rest of the world, they may be seeking change at the WHO, but they're behind the WHO. So help me understand why other countries would now support a new mechanism at the World Bank. Wouldn't this just create a parallel mechanism to the World Health Organization?
Senator, we just received a copy of the bill a couple of days ago, and I know our team is looking at that. I don't know that that would be the case. In terms of, for example, HIV/AIDS, there are multiple organizations that have been created, and I believe that they very much complement each other. I assume that the Senator's proposal would be in that same spirit.
Well, we look forward to your further analysis of the bill, because that's what it seems to me. Let me close. Mr. Richardson, I know that you've talked about the generosity of the United States. I would just say that if I look at the President's proposals for global health in fiscal year 2020, which is more than a 20% decrease in the foreign affairs budget, including a 28% cut to global health programs at AID and the Department of State. And similarly, the proposal for FY 2021 includes, by some estimates, a 34% reduction to the State Department and USAID's global health funding. And the budgets of the President for the last 3 years, had they been enacted, the U.S. would have, by some accounts, $7 billion less to spend on humanitarian assistance in the last 3 years. So to the extent that the American people have been generous, and they have, it has been because the Congress of the United States has put forward these funds, not because that the administration has proposed it. And I have serious concerns, which I'll wait for the second round, as it relates to the actual delays in the obligation of critical humanitarian aid. We have heard from many partners that up to 10 weeks in delay. I don't think that there's a good reason for that, but I look forward to exploring it with you.
Senator Johnson.
Thank you, Mr. Chairman. This is a crisis that is really driven by and really defined by certain data points, certain metrics. Moving forward, if we're really going to respond properly, I think there are certain metrics that I think we have to key in on. I just kind of want to ask some questions about that. If you look at recent past viruses, different outbreaks, H1N1, I guess I'm not a doctor, but I view that as a flu. Numbers I've seen, about 60 million Americans were affected by that, 200 million globally, but it was not particularly deadly. Ebola, I think all told now, about less than 50,000 people have been infected with Ebola. It's about a 40% fatality rate. MERS was, I think, about 2,500 people, about a 32% fatality rate. SARS, less than 10,000 people, and about a 10% fatality rate. Is it safe to say, Mr. Grigsby, that early on, end of December, when this first surfaced in China, the WHO was looking at this, Dr. Fauci looking at this, we were hoping that this type of new virus would be something similar in the order of MERS and SARS, where it might be pretty deadly, but it wasn't going to spread that much. And I think my main point is the main metric there the transmission rate, and how quickly can we really obtain information on transmission rate in a new virus that we've never even seen before?
Well, Senator, I think you've hit upon the problem, and I sort of wish Dr. Fauci were here to answer your questions. He could be is a lot more knowledgeable than I am. But again, the point is that it was a novel coronavirus, and there are other coronaviruses that we've dealt with. SARS is an example, so that's really the only thing that you could go back to and look at. But COVID-19 is not SARS, it behaves differently. But you don't know that until you get into it, and frankly, they're still learning. The scientists are still learning a lot more about it, and will be, I'm sure, for years. And that makes it very difficult to respond to. Ebola is a scary thing. The mortality rate is high. It's very difficult to deal with, but at this point, there's been a lot of experience in dealing with that. There have been new tools that have been created, like a vaccine that's effective and therapeutics that are effective. But early on, that wasn't the case. But once you deal with these things, you become better at it, you learn more about it, and that's what we're in the process of doing.
We've obviously now seen the economic devastation caused by global and national shutdowns. I think we have to take that into effect, the human toll of that as well. I think we're starting to understand that the devastating human toll of what's happened to our economies. Early on, these models, for example, the Imperial College of London, I've read the reports, but the one that really drove so many of these shutdowns, in the first report, the introductory summary estimated without mitigation 7 billion people would contract coronavirus. Isn't that an impossibility?
I confess to you, sir, that I am not an expert on those models. We have people at CDC and NIH and other places that are. We'd be happy to bring up those folks and talk with your staff. There's a whole industry that deals with these modelings.
I guess my point being is I think that what models we rely on to drive policy, we need to take a serious look at that, and we need to take a serious look back at what drove so much of this economic devastation. And eventually we'll find out what the infection fatality rate is. Right now, according to the Oxford Center for Evidence-Based Medicine, they're saying it's going to be somewhere between 0.1 and 0.41%. A bad seasonal flu is about 0.18. We really need to, if we're moving forward in terms of what our response is going to be, we need to identify these metrics that drive the type of policy. First of all, to address the health situation, but also understand what's happening with our economy as we employ these shutdowns.
Right. You're right, Senator. And again, I would just go back to the fact that this is a novel coronavirus, something that had not been seen in humans before. So some of it is educated guesswork. There's no doubt about it.
Thank you, Mr. Chairman.
Senator, if I may just
go ahead.
I think your point is exactly right, sir, and I just want to sort of reemphasize that this idea of having an early warning tracking system, we have early warning tracking systems for famines, right? That's existing program. It's run out of USAID. It's phenomenal. But we don't have effective early warning systems and data tracking systems for outbreaks going into a pandemic. This is a huge vulnerability and a gap in the strategic system, and it's not a gap currently filled by the WHO or any other system out there, and it's something I think we certainly need to look at.
We'll take note of that. Senator Johnson, thank you for bringing this into the area of the economics. It's certainly something that needs to be considered as we go forward with the bill. And the metrics that need to be developed to look at that. Senator Kane.
Thank you, Mr. Chair, and thank you to the witnesses. I want to follow up on Senator Johnson data and ask you some questions about data. So on January 21st, the United States and South Korea both had their first reported case of coronavirus. And on that day, the unemployment rate in both nations was fairly similar. It was 4% in South Korea, and it was 3.5% in the United States. On March 3rd, we had a hearing in this room, I believe, with a HELP committee hearing, not a Foreign Relations Committee hearing, with a number of the political appointees dealing with coronavirus. And on that day, South Korea had experienced 28 deaths, and the U.S. had experienced 9 deaths to coronavirus. And the unemployment in both nations was also essentially similar. Today, South Korea has lost 280 people to coronavirus, and the United States has lost now more than 119,000. The South Korean unemployment rate has risen to 4.8%, while the U.S. unemployment rate has risen to 13.3%. South Korea has 1/6 of the population of the United States. Their GDP is 1/12 that of the United States. South Korean per capita income is less than 2/3 of U.S. per capita income. South Korea is every bit as much affected by any missteps of the WHO, and every bit and possibly more affected by Chinese missteps because of their close proximity to China and the frequency of travel between China and South Korea. Even with vastly greater resources, the United States now has a COVID-19 death rate per 100,000 population that is 80 times higher than that in South Korea. I know 4 people who've died of coronavirus. Did they get right that we got so wrong? So I'd like to ask our panel, how can America and the entire world replicate the more successful strategy that South Korea or other nations, Japan, Canada, Germany, Australia, New Zealand, Vietnam, utilized as we go forward in fighting COVID-19 and preparing for the next pandemic?
Senator, I'm happy to start out. I think that many years are going to be spent taking a look at lessons learned. The World Health Organization just approved a resolution to take the first steps to do the first one.
Is that a good thing? The U.S. support that?
Yes, we did. In fact, we negotiated, the EU sponsored it. We worked very closely with them to ensure that language was in fact in there and was not weakened by other states that were seeking to weaken that language. And there were 140 other co-sponsors. I have no doubt that in our own country there will be countless studies looking at this, and there will be lots of lessons.
Can I ask you, are you guys looking at this? Are you guys analyzing the experience of nations whose death tolls are dramatically less than the United States and asking yourselves, what do we need to do better right now? Not years of analysis. We're still fighting COVID-19. What do we need to do better right now, and what do we need to do better to prepare for the likelihood of future pandemics?
Yes, sir. I mean, we have folks at CDC in Atlanta who do just that. As you mentioned, South Korea is a very different country than the United States, and in fact, even their laws allow the government to.
They're also similar to the United States in a lot of ways. An ally, big, messy, multi-party democracy, densely urban, but also fairly rural. Every country is different than the United States in some ways, but South Korea is a country that has a lot of similarities to the United States, including a very close working relationship.
Yeah. And I think that all of us are going to have a lot to learn from the successes and failures of many countries, including what we've done in the United States. So that's going to be happening for years on something like this that's had this massive of an impact.
My time is close to the end, and I don't want to go over. But, Mr. Chair, I think a hearing on best practices in this committee, and maybe a combined hearing between this committee and HELP, would make a lot of sense, because there are things we've done that we could teach others, but there's an awful lot of things that other nations have done that we should learn to be true to what you say. We're having this hearing to prepare for the near certainty of future epidemics. We should be trying to learn those lessons as quickly as we can.
Yeah. Senator Kane, I couldn't agree with you more. It seems to me, though, that the answer to the question is relatively straightforward, and that is, how tough does the government want to be as far as locking people up so they can't spread the disease? That's that's a debate that probably going to be pretty heated, I would think, depending upon the culture of where you come from. But it needs to be explored. There's no question about it, because the question is, do you want to go ahead, as Senator Johnson and others have pointed out, that if you compare this to the flu, we go through this every year with the flu, and we take hits as a result of that. What are we willing to do in a pandemic like this? And that's a very fair discussion.
And I think, Mr. Chair, just to respond, South Korea is not a China or Vietnam. It's not an authoritarian state. It's a democracy. And so, yes, the government did some things, early testing, and then if people are sick, contact trace, isolate and treat those who are sick. But by doing that, and that was heavy government action, they didn't have to shut down the economy.
Yeah.
So that's why the unemployment rate went from 4% to 4.8%, where ours went from 3.5 to 13.3. So, yeah, tough government action on the testing and contact tracing meant that they needed to do less dramatic government action on shutting down the economy. And other nations are going to have other experiences. And then we've done things that we can, especially our research institutions, that we can share with others. But I just think it makes my skin crawl to think of first case on the same day, similar tiny number of deaths in March, and now 280 deaths in South Korea and 120,000 in the United States. And so I know we can do better. And this committee, with a global health subcommittee, together with the health committee, are the places where we ought to be hashing that out, learning those lessons.
Yeah, fair points across the board. I think also a person pointed out to me the fact that how important wearing a mask is in social interaction. And this person also pointed out that culturally, around the world, there are people that are very comfortable wearing a mask. In some countries, I was told by this person who's an academic as far as these things are concerned, that in many countries, people wear a mask if they got a cold, if they got a cough. Well, you never see that in our Western civilization here, but yet in other countries that's the case. So you're right. I mean, these things absolutely do need a further look at. Dr. Barrasso.
Thank you very much, Mr. Chairman. Mr. Grigsby, I believe the World Health Organization failed the American people, failed the world during the coronavirus crisis, refused to call out China for its disinformation campaign, lack of transparency, the cover-ups, and you made reference to some of this. From the start, I believe the World Health Organization blindly accepted China's leaders' false reporting and understated the threat of the disease. They repeatedly praised China for transparency and spread inaccurate and misleading information. January 14th, we know they pushed out a false information that there was no evidence, they said, of human-to-human transmission of the virus, despite clear evidence of the contrary. But it continues. Just last week, the World Health Organization announced that asymptomatic spread of the coronavirus was rare, and then that made the national and the international news for a day, and then the next day they kind of walked back the claim, so had to change things, lots of inconsistencies. But this isn't the first instance of the World Health Organization's failure to prevent, detect, or respond to a severe infectious disease crisis. As a doctor, I always thought that the World Health Organization's mismanagement of Ebola and the delay in declaring it an international emergency caused, and I called them out publicly about it back in, I think it was 2014. So due to the leadership failures and the repeated mistakes, I think it's time to reconsider the role that the WHO and its leadership play. I agree with the withdrawing of the funding. Reforms are needed. I agree that reforms are needed to ensure the accurate and transparent data sharing to members. So the question is, how do you do this? Another member of this committee said, what leverage do you have after you've withdrawn the funding? I think you have a lot of leverage, because if they say you want the funding restored, you want us to come back and re-engage, then give us the kind of credibility and engagement that is necessary. So I fundamentally, what do you see as the problem with the World Health Organization? Is it a lack of political commitment? Is it a lack of capacity or capabilities? Why are they continuing to fail to implement needed reforms?
Thank you, Senator. Maybe if I could just talk a little bit about some of the reforms that we are discussing with other countries, and it goes beyond G7 health ministers as well. But also, you know, as I mentioned before, this is not the first time. We've experienced this before with the World Health Organization. And in fact, I made mention to SARS earlier, when there were problems again in the West Africa Ebola crisis, that led to more reforms, creation of the emergencies program at WHO. The Obama administration at the time actually had to redirect funding away from WHO because WHO couldn't get its act together and even accept the money. So that went for good work that was going on in those countries through private organizations. So this sort of thing is not new. There's a big difference between the COVID-19 pandemic and how that's impacted the world and the West Africa Ebola crisis, which was more regionally focused. But, you know, we have had many encouraging conversations with other countries regarding the need for reform. I mentioned a few of those in my statement. And really, you answered Senator Menendez's question better than I did. But the fact remains that if WHO can get its act together and can make the reforms and can prove that it has independence from China, I'm sure there's every possibility that the relationship that the United States could be changed. But the ball is in their court. And there are a number of reforms that they need to undertake. And we have really a remarkable amount of agreement and common ground with other health ministers that we're dealing with on the need for reform, notwithstanding our relationship with WHO. That's beside the point. So the ball is in their court, and we hope that they will embrace these reform proposals.
Can I ask about the development of a vaccine? Can you please discuss the steps, Mr. Grigsby, that the administration is taking to engage with our global partners to ensure that the vaccine can be developed and distributed as quickly as possible?
Yes, sir. You know, we have our own projects that are going on, Operation Warp Speed, and we're investing a lot of resources in that. There are other efforts going on globally. We have collaborations and conversations and share lessons learned and provide technical assistance to really all of these efforts. We're rooting for all of the efforts. We're going to need more than one vaccine. We're going to need more than one company because we're going to really need vaccinations for everybody on Earth, ideally, and easy access to that. So there are a lot of different things in play. We have folks that their job is to work on these. I'm happy to bring up some folks, technical experts and scientists who could speak with you and your staff. We're happy to do that anytime. But there are a number of initiatives going on, and our department and the White House as well, that they're in discussions with, I'm assuming, all of them.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Booker.
Thank you very much, Mr. Chairman. It goes without saying this pandemic has hit the United States of America pretty significantly, and within that context, my state of New Jersey has seen the worst of this pandemic, and the lives lost, the families facing devastating grief, and the struggles that we've seen have been a legion. I'm grateful that it was already said in this committee that we have a serious problem with, at a time that people were calling into question China's secrecy. We have a president that was praising China. At a time people were demanding transparency from China, this president was coddling them and encouraging them in numerous public statements, in numerous tweets, and we were failing, as people in New Jersey were dying, we were failing to hold them to account for the challenges that were before them. And so I continue to be concerned about our policies regarding China, and that go beyond tough talk, but to really working to get results. According to reporting, China appears during this crisis to have nationalized control of domestic production and international distribution of critical personal protective equipment in early 2020 in response to this crisis, including that of the U.S. companies such as 3M, which produce PPE. This is a significant challenge. Under their action of nationalizing their control, China required factories that make masks on behalf of American companies in China to produce masks for its own domestic use. Now, China is currently exporting more masks, and these exports seem to relate to political calculations, with the U.S. receiving less priority than other markets. China's mask diplomacy, or China's distribution of masks and medical equipment in order to curry favor, has been widely reported. I'd like to really know, how is China, in your perspective, and maybe address this to Grigsby and Richardson, how is China prioritizing their exports of PPE, and how is the U.S., in your view, benefiting or to the detriment of our country? And really, the entire world saw the images of our healthcare professionals working without adequate PPE while we waited for China to release the supplies of PPE. What have we learned as a nation through the process in the event that another surge of another surge of the coronavirus hits, and we find ourselves with heightened demands and needs for PPE? I'm very concerned that this problem still is ongoing and that the Chinese policies are still working at a significant detriment to the United States of America, and we're not doing enough. So I'd like a response from Mr. Grigsby and Mr. Richardson, if possible.
Thank you, Senator. I think your comments are spot on, and I don't know that there are many silver linings to this terrible crisis, but I think one of them is going to be, I can assure you, a reexamination of the supply chains. I believe that everything you mentioned is true in terms of that, and I can just assure you, this is not my office that does this, but there are a lot of people, not only in HHS, but across our government, working very hard specifically on the supply chain issue. It is a big issue, and thank you for raising that.
Thank you, Mr. Grigsby. Mr. Richardson?
Yeah, thank you, Senator. I totally agree with you, and I agree with Garrett. When you look at China, and I wouldn't just look at it in the context of COVID, but if you look at their approach to foreign assistance generally, they have a really mercantilistic, very strategic approach to all of what they do. They're looking at strategic mineral rights. They're looking at strategic ports. They're looking at bribing officials in order to get their companies access to things. That's really the Chinese approach to foreign assistance writ large, and I think it does set up a really great dichotomy between if you want to go with China and accept that type of assistance, you're gonna go backsliding on your governance and your transparency, and it's not ultimately going to be the most successful for any of our partners. I think what the U.S. really offers with our partners, donor partners, offers really a different solution of transparency, no strings attached assistance, and those types of things. It's a critical issue.
So I'm grateful, and I do not think we're sounding the alarm enough. We see the authoritarian regime of China working against our country, from currency manipulation to corporate espionage and stealing secrets. We've seen this behavior consistently in how they deal with foreign relations. But now, in the nature of a pandemic, it is chilling to see that their actions and what they are doing is putting lives in our country at risk in the past, right now, and especially within the potential for a second wave. I'm grateful you are echoing, Mr. Grigsby, what I've been saying in this committee, in the Small Business Committee, is the supply chain issues are national security issues. And we need to be acting with bolder, far greater action to protect our nation from this menace that seems to be the Chinese intention to undermine our safety, our health, and our well-being. I want to ask very quickly about wet markets, because I have great partnerships across the aisle. China CDC announced it found COVID-19 in samples collected in a wet market in Wuhan, China in January. There's a new outbreak right now in Beijing, but China yet again, in this outbreak, we see that it is still linking a lot of the challenges to wet markets. These live wildlife markets were also linked to the 2003 SARS outbreak. Scientists studying zoonotic diseases that jump between animals and humans, have pointed to the close proximity of shoppers, vendors in these markets as they're being prime locations for the spread of these pathogens. And so we know from SARS, which I mentioned, Ebola, monkeypox, COVID-19, MERS, and more jump from animals to humans. It is clear that wildlife markets that sell wildlife animals for human consumptions need to be shut down. Senator Graham and I sent a letter to the heads of international organizations urging them to engage in efforts to shut down these markets. And so very quickly, and then I'll stop, and love to ask this question to Milligan and Richardson, is how should the U.S. work through international organizations and international wildlife community to increase the awareness of this risk and really to begin to take real measures to shut down and ban wildlife markets so that we do not see this challenge again. I'm grateful to be working with Senator Cornyn, Senator Graham, and others on legislation, but to me, this has got to be an international priority, and I would love to get your thoughts on that.
Yeah, thank you, Senator. I appreciate those comments. The state and USAID have really robust programs when it comes to preventing wildlife trafficking, environmental programs, and we have a fairly broad reach, although a lot of the countries that are the greatest offenders, like China, we don't have a lot of those types of programs in some of these countries. So I do think we need to expand, not just in the development piece that Chris can certainly will have better insight in, but on the diplomatic side. I think that we've got to do a 1-2 punch here, but working together, I think we can make a real progress. But Chris?
Thank you. And I think what this shows is that these issues are all interrelated. You can't look at just a simple health focus. It's all interrelated. We have a tremendous opportunity now to build more commitment behind preventing wildlife trafficking by actually messaging on CITES and by talking to many of the countries that enable this to happen about the consequences and the downstream effects. So this is a tremendous opportunity. And going back to the whole sanitation issue that you raised up, we are prioritizing many of our investments in water and sanitation and hygiene, particularly for that reason, that we can prevent the spread of this disease as it goes forward. So, Senator Booker, your point is well taken that these issues are all quite interrelated, but we have an important ability now to message strongly and show these connections, which can help have a broader impact on these important issues such as countering wildlife trafficking.
Thank you. Thank you. Thank you, Mr. Chairman.
Thank you. Thank you, Senator Booker, for raising the supply chain issue. That's certainly something that's critical. This ties in a little bit with what Senator Kane was saying, and that is that one of the things that South Korea did, it had an all-of-government approach to this thing, and they shut down their supply chain out. They hung on to everything that they had, and what's happened in this is there's been a real underscoring of the weaknesses that we have as a result of a lot of our manufacturing going overseas. And I think there's some of that manufacturing that's national security, and certainly a health challenge is a national security issue like anything else. I have no doubt we're going to be looking at that as we go forward. So thank you for that. Senator Murphy.
Thank you very much, Mr. Chairman. In response to a question about global vaccine efforts, Mr. Grigsby said that we're rooting for these efforts, and I'll maybe direct this question to Mr. Richardson because it probably matters more what this than the head of the CDC. Why should we just be rooting for these global vaccine efforts? In fact, we could be part of these global vaccine efforts. In particular, there is one that is probably the most promising. It's CEPI, the Coalition for Epidemic Preparedness Innovations. All our allies are a part of it. It's frankly doing work as we speak with U.S. companies. The legislation that Senator Risch and I have would authorize the United States to become a partner with CEPI and put money behind that effort. So what's the administration's specific position on the wisdom of joining this particular global vaccine effort? It just seems to be a lot smarter for us to be at the table. So if CEPI is the one that produces a vaccine, that we have something to say about where that vaccine goes and who gets it first.
Yeah, I appreciate that, Senator. CEPI plays an important role, certainly. Gavi also plays an essential role. The administration just made the largest pledge ever for an American government to Gavi of $1.6 billion. So I think our commitment to the international effort for vaccines is pretty strong. I would say that if you look at what we have done, and a lot of this actually is on the HHS side, but $4.5 billion we've invested through BARDA. We've allocated $350 million for vaccine efforts, $1.8 billion for rapid acceleration of diagnostics. I think there is a lot of work that has already been happening in the U.S. Am I going to say that we shouldn't coordinate more closely with our partners and allies around the world? Well, of course we should. That's a great common sense approach. I will say, and I don't know if your question was leading to the EU conference before, but the U.S. has invested private sector and public dollars, over $12 billion so far, into vaccine development and therapeutics.
I don't deny we're spending a lot of money on vaccines. My question is not whether we are spending enough money, it's whether we are better off hedging our bets and making sure that we are not only doing that domestically, but we are also joining these international efforts. I hope that the administration would be open to a bipartisan congressional legislation pushing us towards joining CEPI. I think there is bipartisan support here. Mr. Grigsby, I did want to turn back to this question of the WHO. I mean, I do think it's pretty stunning to hear from the administration that the problem early on was that the WHO was giving cover for China to withhold information about the vaccine. And Senator Menendez covered this, and so we don't need to belabor the point. But it was not that the president was simply saying nice things about China early on. On 40 different occasions, up to and including the month of April, the President of the United States was the primary global cheerleader for the Chinese response to COVID. He went out of his way over and over and over again to say great things about the Chinese response. Here he is on February 7th. This is far after we all recognized that China was withholding information. He gets a direct question at a gaggle. Are you concerned that China is covering up for the full extent of coronavirus? February 7th. He has an opportunity right here to say, yes, I'm concerned about it. They need to give us information. His answer is no. China is working very hard. And I've got 20 pages of this from the president. And so it just belies reality to suggest that the problem was the WHO covering up China's response. The president of the WHO is not more powerful than the president of the United States, and we all need to acknowledge that. My question to you is this. The idea that we're going to try to affect WHO reform through the G7 is a new one. Can we at least just stipulate, for the time being, that it is harder for the United States to impact reform of the WHO if we are not a part of it rather than a part of it? It might just be good for us to stipulate that. Whether or not you're going to try to pursue reform through the G7 or not, can we at least stipulate that it's more difficult for us to get the WHO to reform if we have withdrawn from it?
Thank you, Senator. I think as Senator Menendez or another senator had mentioned, WHO is a member state institution. Our conversations with the G7 are important because it really represents the most significant and influential donors to the World Health Organization. I would say that if WHO and other countries do not want to see the United States leave WHO. There's no doubt about that. It's important for WHO to embrace these reforms and at the appropriate governing bodies meeting for member states to take these reforms up and approve them.
There's one country that is desperate for the United States to leave the WHO, and that's China. They are going to fill this vacuum. They are going to put in the money that we have withdrawn, and even if we try to rejoin in 2021, it's going to be under fundamentally different terms because China will be much more influential because of our even temporary absence from it. And any other construction of reality is just putting the United States in a very, very dangerous position. Thank you, Mr. Chairman.
I guess I would say to that, sir, that the U.S. has been the most generous donor to WHO really since the beginning. It's been remarkable, the increase in China's influence within WHO really over a long period of time. That's been with the United States in WHO and being the most generous contributor to WHO. So the president made a bold decision. There's no doubt about that. Personally, I hope that it will get the attention of the leadership of the World Health Organization and that the scenario you just described will not come about. That's at least my hope.
I just finally note, we were continuing to fund the WHO for the last 3 years, but we left our seat on the board vacant. So it doesn't take a lot of imagination to figure out why China was able to get more influence if we were sending money but not sending anybody to sit on the governing board. So we invited, listen, I'm not defending the fact that WHO has gotten closer to China, but we essentially invited the Chinese to step in and fill the shoes of the United States, given the fact that we weren't sitting on that governing board.
Senator, I actually have something to do with that, so I would like to respond to that. I'm actually the alternate board member, and I'm sure I don't do nearly as good a job as a Senate-confirmed person, but that seat was not vacant, I assure you. And in fact, Ambassador Bremberg or his predecessor, the ambassador in Geneva, they're always there to fill that seat. And Dr. Joie, who's the Assistant Secretary of Health, he was actually nominated, I think it was 2017. So he was nominated a long time ago, and we sure do wish we could have had him confirmed sooner, but he was just confirmed a couple of weeks ago. He was nominated last year and had to be renominated again this year.
All right. Well, I won't get into an argument over whether it is more effective to have Senate-confirmed positions or not. I would obviously argue that it is. I'm well over my time. Thank you, Mr. Chairman.
Thank you, Senator Murphy. Mr. Grigsby, I can tell you that I've got contacts with the WHO, and your suggestion that our talk of withdrawing funds might get their attention, I can assure you it has gotten their attention. And it's probably been your experience too, but it's clearly my experience. So in any event, we want to look forward as opposed to backward, and we're going to talk about that in a few minutes. But before we do that, Senator Cardin.
Well, I hope I'm looking forward. Mr. Chairman, thank you very much for holding this hearing. Let me thank all of our witnesses for their service to our country. On global challenges, U.S. leadership is indispensable if we're going to have the type of outcome that's in the interest of the United States and our security interests. And this committee knows that best. So that's why I was very pleased to see that we're holding this hearing. It's through U.S. leadership that we have a safer world, a more democratic world, and a healthier world. So many of us are very concerned as to how the United States responded to this global pandemic. We've seen inconsistent information coming out from the White House, and that's being kind to the president on a lot of the things that he has done in regards to this pandemic. We have not seen the type of preparation or response to the pandemic that would be used as a model for the world to respond. And I think Senator Kaine pointed out that pretty clearly in his questioning. This is not an isolated example of the Trump administration in regards to global affairs. I could point to the immigration policy of this country, and I was very proud that the Supreme Court ruled the president's actions in trying to end the DACA program was, in their words, arbitrary and capricious. But we also could talk about the president's trade agenda that initially put us at odds with our trading partners, our traditional trading partners, rather than trying to isolate China. or the United States pulling out of the Paris Climate Agreement, the only country in the world, basically, to pull away from that. And now the pandemic. So my question starts off with the effectiveness of U.S. global leadership on this pandemic. When other countries look at what's being done here in the United States, how much influence do we really have in the behavior of other countries? Because they look at what's happening in the United States, they see the president holding a political rally, bringing lots of people together against the advice of the public health officials. So how can we complain what's going on in other countries? And my question is going to deal specifically with some of our largest countries in our hemisphere who have at least publicly reported that their cases of COVID are very much underreported, and they have not taken the steps that public health officials believe is necessary in order to contain the spread of COVID-19. This is our hemisphere, and we know this is a global pandemic. How much influence do we really have, and how much of concern are we what's happening in our own hemisphere with other countries that are underreporting COVID-19 and have not taken the steps that public health officials believe are necessary in order to contain this virus?
Yeah, Senator, I can start that. I appreciate that question. We're really truly committed to the Western Hemisphere. I think we just announced another $250 million to be turned on for the Northern Triangle countries. Our commitment to Colombia is unprecedented. Mexico.
I'm trying to limit this to COVID-19 if
Sure.
I can.
Yeah.
And you might want to also point out that Congress appropriated almost $2 billion of aid to deal with COVID-19. Can you tell me how much of that money has actually been spent and where it's been spent?
We can go and look exactly at the obligations by country.
Not obligations. How much has been spent?
That's how much has been spent. Yeah. So
can you give me a range of that $2 billion? How much has been spent?
Yeah. So Congress has appropriated $1.6 billion for state and aid. So I can speak to that piece. We've committed about $1.3 billion. Of that, we've committed almost $200 million for the Western Hemisphere.
And you say committed. The money is actually out. It's being spent.
We've identified which projects.
I understand you identified. How much of that has actually been spent?
So it gets down to the obligation rates, which USAID actually does their own obligations. I'll turn to Chris to answer specifically. But in general, we've obligated but almost over 500.
I'm not interested. I want to know how much has been spent. This is a global emergency.
Right. So
time is critical.
Yeah.
How much has actually been spent?
So obligation equals spending. It's when we actually hand over the money to the implementing partner to do the work. And so that's the big picture. And then I could turn over to Chris if he has more details on specifically for Western Hemisphere what the obligation rate is. I will say, one thing. So each individual bureau and an agency handles their own obligations rate. So I can speak for the State Department side. State Department has obligated every dollar that we've identified that we want to spend on COVID. So that's happening. Aid has a different mechanisms and different approach to this, and so I can let Chris sort of elaborate. But I think, well, let me just do that, Chris, if you want. Have this conversation.
Thank you, Senator. The easy answer from our perspective is that USAID has put over $1 billion into the hands of people overseas to respond to the COVID-19. That includes the portion of the supplemental that we are still continuing to put in people's hands.
How much of the supplemental has been spent?
More than 50%, sir, of the portion that we control. But
and why hasn't all of it been allocated?
We've been allocating in tranches because the virus moves very quickly. And what we need to do is see where the virus is going and then move ahead of it and prepare and learn as we go.
Do you need more money? Are you going to be requesting more money?
We are busy obligating the money that we have, and we're very, very thankful for the generosity of Congress in this. We are not through this pandemic, and we are learning a lot. One of the things I'm most concerned about, sir, are the secondary and tertiary impacts. We're seeing a big rise in food insecurity. We're seeing a democratic backsliding. We see 1.1 billion children out of school. We're alarmed about gender-based violence. So there is a whole set of secondary and tertiary impacts that we will have to consider going forward, sir.
I just would ask if you would keep our committee informed as the money is actually spent and the request for additional funds as you see the needs.
Yes.
No, absolutely, Senator. And just to pick up on what Chris mentioned, we have $35 billion that's being spent every year on foreign assistance, much of it going to Western Hemisphere. We want to make sure that every dollar is spent in a COVID-sensitive way, right? How do we make sure that our gender-based violence programming, our education programming, our health programming takes into effect of what's happening with the virus right there, right then. And so it's a really important conversation. So it's not just, as Chris mentioned, it's not just the supplemental. We're really trying to bring to bear all of our foreign assistance in order to help countries overcome this virus.
Thank you.
Let me follow up on Senator Cardin's question. On the 50% of the money, the supplemental money that's been put out, has that been spent on the primary effects of COVID, or is some of it spent on the secondary and tertiary effects that you've quite properly and considerately
it's a mix. So Congress has appropriated a certain amount of money for our economic support fund, which is really looking at that tertiary and secondary impacts. We also primarily, most of our resources are coming in the form of both global health and humanitarian, which do focus more primarily on the actual virus and providing critical medical supplies, training healthcare workers, looking at best practices, those types of things.
Thank you so much. Senator Shaheen.
Thank you, Mr. Chairman, and thank you to our panelists. I'd like to go back to China. There's been a lot of discussion about China and their role in the hearing today. We've seen a concerted effort from China to counter any negative narrative that may develop in the international media and within countries on China's role in the pandemic, and I would say, given the discussion this morning, they've been pretty successful. They've demonstrated a clear willingness to use their resources, including the manufacturing of personal protective equipment, to realign national sentiments in countries that may otherwise be inclined to critically examine China's response to the coronavirus. In fact, the Center for Strategic and International Studies released a report earlier this month that surveyed political elites across Southeast Asia and found that China is gaining ground on political influence and far outstrips the U.S. on economic influence in that region. So I have two questions for you, really. One is, how does the lack of U.S. leadership on the pandemic response create a vacuum that allows China to better develop that narrative where they are the provider, helping countries with needed resources and expertise? And secondly, how does the pandemic contribute to this dynamic in Southeast Asia in a way that has a negative impact on the United States and our role?
Yeah,
I'm happy to have whoever wants to answer it.
I can start, and then I can pass it on. I mean, I just totally agree with your premise of your question. I mean, the reality is China has used this pandemic to advance their strategic interests around the world. As I mentioned earlier, it does need to be seen in the context of their larger efforts. I think we have a lot of work to do, especially on the public diplomacy side, to counter misinformation, and our Global Engagement Center does a great job of doing that.
Well, I'm sorry to interrupt, but let me just ask you, why do you think that is? Why have we been slow? Has it been some of the statements that were read from the President that suggest that we have been slow to recognize what was happening in China?
No, actually, I think what you're seeing is that the United States has outspent China time and time again, both in its everyday foreign assistance, right? China spends $400 million or so on foreign assistance, and we're at $35 billion. I mean, they are just not a significant player when it comes to what we would consider to be effective foreign assistance. They spend all of their resources trying to build up strategic ports and to engage in bribery and other aspects. And so I think it's an asymmetrical challenge from a development perspective, and we need to develop asymmetrical responses accordingly. And Congress was really smart in last year's appropriations bill. They established what's called the Countering China Incentive Fund. And we're going to be spending the $300 million through a bottom-up process, trying to develop best practices across the world to say, how can we effectively counter China in Djibouti and in Malawi and in El Salvador. This is not a Southeast Asia problem. As you know, China's influence has dramatically shifted, and the next battlefield is Africa and Western Hemisphere, and we want to position ourselves in order to be able to be, one, the partner of choice always, and two, remind people of the everyday commitment we have been making to countries over the past 40 years. We've been there. We've stood with countries through thick and thin. As I said, we've invested $500 billion just over the past 20 years.
Well, I agree with that, but a lot of that $500 billion has not been in humanitarian and economic development aid. Is it? When you are counting that $500 billion, are you not counting the military aid in that as well?
Yeah, so about 25%. So the way that our budgets work, about 25% of our foreign assistance is security assistance, and that's not just military. That's also law enforcement and those types of things. 25% is global health, 25% is humanitarian, and 25% is everything else.
So, given that, why do you think we have not been more successful, and China has been successful?
I would like to, please. I've been working in development for 30 years, and most of that time I've been overseas. And yes, we've seen the quick increase in Chinese influence. But we're also seeing that China is not now as successful in many terms. There's a lot of buyer's remorse and more understanding that Chinese investments come with strings attached. The supplemental that we are implementing has a very important public diplomacy side that really shows American leadership. And countries overseas are turning to us and to our embassies for leadership on this issue. And
so I'm sorry to interrupt again, but I'm out of time, and I just want to get an answer to what has the pandemic done to allow China to increase its influence as opposed to our reaction globally to the pandemic, which does not seem to have produced a similar response to American aid?
Yeah, I mean that's a tough question to obviously to answer, and we can't. We'd have to go country by country to really determine. Every country is unique in how they approach it and how they think about Chinese assistance. Most countries are willing to accept face masks or whatever from China, but to Chris's point, they often then go around to us and say, "Hey, is this financing deal from China any good?" That we're the trusted partner in choice, even though we've seen China really accelerate. But if you look at their investments, even in COVID versus what the U.S. has invested, it pales in comparison. I think they're just really focused on getting those headlines.
Well, let me just point out that the state of New Hampshire was able to get personal protective equipment from China when we couldn't get it from the United States or from FEMA. So I think we need to examine what's happening there and what we could be doing better in order to address the fallout from the pandemic. Thank you, Mr. Chairman.
Thank you, Senator Shaheen. Now, the tough questions. If you guys were sitting here, each of you, one at a time, what would you do to construct a system for the future? Would it be to rehabilitate WHO, to reform WHO, to create a new division of WHO, to restructure its management? Would it be to create a new international agency? Would it be to use something else like CDC or what have you to construct a system as we go forward? I want to say that Senator Menendez raised a very legitimate question about parallel spending in another organization. And I think the last thing anybody here wants to do is to create more bureaucracy as opposed to an effective, nimble response to this in the future. And so give me your thoughts. I guess we'll go right down the line. Mr. Richardson, you're up.
Well, thank you, Chairman. Whenever you deal with these challenges, I always want to make sure we're thinking about what problem we're trying to solve and what results that we're looking for. The solution and the specifics about the solution will naturally come, and that's through the legislative process. The administration has yet to finalize its own proposal in this space. But let me say that a couple things. First and foremost, having a really clear leadership and coordination function is essential. And as I said, coordination doesn't mean control. It means empowerment. We shouldn't be, the State Department should not be doing global health programming. That would be a terrible duplication of efforts and really takes away from what CDC and USAID does. But the State Department also has global reach. It has embassies in nearly every country in the world, and it has a natural coordination function that is essential. The other gaps into the system that we've seen in both the domestic and the international systems is data tracking, is built-in accountability. How do we create true accountability into the international system to hold countries accountable for not meeting minimum standards? How do we make sure that we are encouraging countries to use their own resources in a coordinated and systematic way that allows us to better share data, to be able to create early warning systems? And how do we bring the very best of our private sector and the U.S. government to work together? So those are a couple thoughts.
Those are all good questions, but not much of an answer. When the fire alarm goes off, who responds?
The State Department is the functional lead for foreign policy for the United States.
How about for the world?
For the world, sorry. The CDC is responsible for outbreaks or for public health emergencies. USAID leads on complex crises. So each one of us has our natural roles and responsibilities. And so I would encourage us how we can pull all of our expertise together in order to solve the problem.
So the criticism has been made both in this committee here and for a long time. The WHO fell down on the job when it was obvious that there was something developing. Should they be the ones to undertake this in a fast-moving pandemic like this, or should there be a different agency that does that shines light on it, that attacks it, goes and gets it? Who should do that?
I appreciate that. I don't think that, look, the WHO has failed the world on multiple occasions. The last administration saw the same thing with the Ebola crisis. We've now seen this with the COVID crisis. When this problem has been brought to us before, this is not the first time we've had to think about, can the WHO do HIV/AIDS response, for instance? I think the world said, no, it does what it does, but it's not going to be nimble, dynamic, respect burden sharing, bring in private sector actors, and able to respond appropriately with the highest levels of accountability. So last time, the U.S. led to create the Global Fund in order to do something on the HIV/AIDS side. And so I think that looking at where are the strategic gaps in the multilateral space and how the U.S. can lead with our friends and partners and folks around the world in order to strategically fill those gaps, that will be an essential part of that conversation.
So is a Global Fund a model?
I think the Global Fund is a tremendous model. I think Gavi is also a tremendous model. I think there's a lot of things to be learned from lots of different options out there. I think the really key here is having worldwide reach, focusing on burden sharing. Right now the U.S. spends 40% of the world's global public health work comes from the American people. We don't want to back away from that, but as we take on this new challenge, we really need to surge in both private sector and other donors into this space. And both the Global Fund and Gavi have tremendous models about how to do that well.
You agree, Mr. Milligan?
Thank you, Senator. When I think about the future, I think we need to think about how do we respond to the next pandemic, and how do we prevent also as well. an epidemic from becoming a pandemic? And then how do we structure ourselves to effectively engage in that effort? We know that in order to respond, we have to maintain a nimble and effective means to do so. We can't have an overarching top-down bureaucracy engaging in that.
We've learned that the hard way.
And we need to empower our people in the field at the country team level, because that's where a lot of the true coordination and expertise comes due.
Do you agree with Mr. Richardson that the vehicle, good models for the vehicle are the Global Fund and Gavi?
That depends, sir, because it's a model for what? I don't mean to be cheeky, but a model.
No.
Because we're
fair
looking.
enough.
Preventing is very different than responding, and those are different skill sets and different attributes. So when I consider about preventing, we know that a pandemic is not really a health crisis; it's a governance crisis. We know where we have epidemics today. We have them because of state fragility. Where is Ebola today? Eastern Congo. Why does polio still exist where it exists today? It exists in fragile states like parts of Pakistan and South Sudan. So many times an epidemic is really a governance crisis masquerading as a health crisis. And we need to make sure that we have an integrated approach. Senator Booker talked about the link between wildlife trafficking and zoonotic crossovers. So when we look about preventing, there's a level of coordination that needs to take place. We can't have a stovepiped health alone approach that creates another layer of bureaucracy. It has to be something that brings everything together. When we look at the response side, we have to maintain our nimbleness and our ability to actually engage in that international effort at multiple levels.
And what agency or what system, what do you recommend in that regard? Again, is the global, for that part, when the fire alarm goes off and the fire department goes, who's the fire department?
Correct. It's not necessary. We don't really have the Global Fund or the Gavi set up to be the fire department. The Global Fund is responding to slow-moving epidemics.
So is there no model then that exists for the fire department?
The only model we currently have is the one that we're suggesting needs to be reformed. Currently, when there's a humanitarian assistance crisis, and I've led many of our interactions in them, we work through the UN cluster system. The UN actually sets and organizes the international parts together. It works well for a regional stage, but now we don't have a model for the pandemic stage. But we have principles that we need to incorporate: flexibility, responsiveness, integrated approach, and one that brings the U.S. government core capabilities that we share at this table into that together.
Mr. Grigsby.
Yes, sir. Thank you. I think Jim and Chris have stated it quite well. And I just want to thank Jim and colleagues at U.S. Agency for International Development. We've worked very closely with them in the development of these ideas. We appreciate that. We do support the coordinator concept being in a non-implementing agency. I would just point out that most of what we're talking about is sort of foreign assistance related. CDC, which would be the agency in HHS that would have the most to do in this area, it's not a foreign assistance agency. It really is a technical assistance agency. It operates differently than USAID, and in fact in different places. It does have 50 or 60 offices in developing countries, but it actually operates in every country on earth. So rich countries, poor countries, it has all sorts of collaborations. But we...
Are you suggesting CDC is the model for the fire department?
No, not necessarily. It just depends on what kind of fire that the trucks are going out to address, I guess. I mean, CDC is on point when it comes to the pandemics and disease outbreaks. There's no doubt about that. It oftentimes works very closely with U.S. Agency for International Development, particularly in a case in Eastern DRC is a great example, where there is a disease outbreak and it's happening in a part of the world where there's a war going on and many other problems, and it's by definition a complex emergency. So we work hand in glove with USAID on that. So I don't know that there's a one-size-fits-all sort of answer. It's kind of case by case, but
Well, thanks. I was hoping to get a clearer answer to the question of who's the fire department, because that's what we're trying to do here. I get all the moving parts. I understand that. But it seems to me that if there was a telephone number that somebody could call and say, come and put out the fire, we want that agency. And right now, what you're suggesting is we give them a list of phone numbers to call, and I'm not sure that responds.
Yeah,
but.
Senator, if I could just be very clear, there already is a number that countries call when they have a problem. It's our ambassador. And that's really where our worldwide reach is really essential. And then our ambassadors and chiefs of mission around the world, they naturally lean on the technical expertise depending on the challenge, right? And I think this, as we start thinking about what the next pandemic looks like, is it fast moving? Is it slow moving? Does it hit the developing world? Does it hit the high income countries? How does it work? What are the responses that we need to do? We just don't know. And so making sure that we have true coordination that can pull the right levers at the right time in order to get to results, I think is essential. But I certainly wouldn't want to move away from the fact that we do have worldwide reach today. People know who to call, and that's our chief of mission at the State Department, and we want to just look to strengthen that capacity.
And if I could add briefly to that, I would say that our ambassadors, they are the mayors, and the firemen is the Office of Foreign Disaster Assistance, which mobilizes rapidly through DARTs around the world. We're currently responding to very, very complex humanitarian assistance all around the world and complex emergencies. So from our U.S. point of view, we have firemen. But I think your question, sir, was should there be and will there be an international fire person?
That's what we're looking for. Senator Keene, anything for the good of the order?
Just to follow up, Mr. Chair, on your comment and then one additional question. I'll put myself firmly in the camp on this, and that I think we ought to stay in the WHO and use our leverage to push reforms. An enormously frustrating organization, like every international organization. The U.S. chose not, the Senate actually chose not to put the U.S. into the League of Nations when President Wilson urged after World War I that we do so, and the organization was ineffective. It was more ineffective because the U.S. wasn't involved, but it was interesting, during the 1930s, long before World War II, FDR could see the League of Nations collapse coming and basically said it's been ineffective, but if it collapses, we're going to have to recreate it. The world needs it, and started planning for a UN. Those plans were delayed by World War II, but eventually Presidents Roosevelt and then Truman carried forward on it. Recognizing the frustrations, the U.S. pulled out of the UN Human Rights Council for some very legitimate reasons, a history of anti-Israel bias, and also a more broad history of hypocrisy. The member nations, were fulminating about human rights and doing bad things. But what's happened as a result of us pulling out, has it gotten better for Israel? No. And things that the U.S. advocated on the Council that did become global priorities, for example, fighting against discrimination against LGBTQ people, that wouldn't have been part of the global human rights agenda if it weren't for the United States. Those have gone unaddressed or sort of dormant with the U.S. not there. I think these organizations are enormously frustrating, but I think it always goes worse for the world if the U.S. isn't involved, and I think it generally goes worse for us as well. And so I like the president, whether it's with NATO or the WHO, lean on them, demand more accountability, more strings have to be attached, but it just goes worse for the world if we're not there. I'm so confident that the U.S. always has such a value add to any organization that when we back away from it, A, they lose the expertise that we uniquely have, and then worse actors elevate their profile in ways that's not good for us or anyone else. Here's the question I want to ask you quickly, and it follows up on a conversation I think you were having with Senator Cardin. There's a New York Times piece in the last week about on-the-ground agencies feeling frustrated about the slow pace of the delivery of the March CARES Act and other money, this $1.6 billion, out into the field. And you've given us basically an awful lot of it has been committed, a big chunk of it has been obligated, and I just want to understand this. and maybe we'll follow up in writing, but obligation means you put it in the hands of the organization. You know, the U.S. is writing a check to an organization. Is that the same thing as getting to the field? Might some of the complaints of these ground level, you know, Church World Services, Save the Children, World Vision, might their complaints be the U.S. has written a check to somebody, but there's a middleman problem and it's not getting down to the ground yet? Because this was a recent piece in the New York Times with groups named that were really frustrated. What's the source of their frustration? How can we solve it?
Senator, I think that their source of their frustration is that they want to act as quickly as we want them to act as well. Without getting very bureaucratic, our different accounts have different abilities to spend money. We hear these concerns from these NGOs, our important partners. With the humanitarian assistance funding that we have, as soon as it's available, they can begin spending it. We don't have to have a contract with them. We contract directly with them. We don't go through middlemen.
Okay.
As soon as it's available, this is a unique ability we have with these funds. And so of the $535 million in humanitarian assistance funding, they can currently spend $267 million, and by July 17th, they can spend all of it. So that is in addition to that is part of the overall funding that we've made available, which is $1 billion that we've made available, it's in their hands to do work now. We are looking at ways of actually streamlining the process. We are committed to fully obligate all this humanitarian assistance by the end of July. I have to tell you, these are extraordinary times. Previous to the global pandemic, we were running very large-scale humanitarian assistance efforts in very difficult places like Yemen, Iraq, South Sudan, and Syria. And the global pandemic has also affected our own workforce as well. But we are adapting, and we're streamlining, and we're meeting the challenge.
Thank you. Appreciate that. Thanks, Mr.
Thank you, Senator Kane. To our witnesses, thank you so much. You've been very patient with us, and this is a part of the puzzle that we're trying to solve here. We appreciate your thoughts on it. We hope to hold a number of these hearings to try to get as much input as we can, and then as a committee sit down and try to construct a bill that is going to move us forward, and that when this happens again, and I think we're all under the belief that it is going to happen again, hopefully later rather than sooner, that we'll be more ready for it, and hopefully we'll have some legislation that will address that. So with that, thank you again for your service, and thank you for attending this hearing. The committee's adjourned.